Right, for more on the story in Yemen, let's cross over to Sana'a, where Ali Mudhwahi joins us now. He's the General Director of the Family Health Department at Yemen's Ministry of Public Health and Population. Ali, thank you very much for joining us now. We just talked about the prisoner swap. Is this part of trust-building exercises in Switzerland?
Yes, we are trying now to provide the help that it's needed in the most affected governorates, benefiting from this ceasefire that was supposed to start yesterday. But we managed to send trucks through the World Health Organization to the most affected 7 governorates in the country, including, of course, Saada and Taiz and Marib, where armed conflict is still taking place. And we are trying also to monitor the epidemiological situation through surveillance, because in some areas in Yemen, with this catastrophic situation, we expect that outbreaks may re-emerge for some diseases like malaria in some areas that was eradicated before, like Socotra Island, and also for other diseases that were about to be eliminated in Yemen, like measles, for instance. But unfortunately now, vaccination coverage is very low, and we are expecting that this will be also an outbreak affecting mainly children under 5.
All right, Ali, let's continue with the humanitarian crisis. Is there the infrastructure and the operational capabilities in the country to disperse aid to victims and citizens?
Now, as World Health Organization, we are working with other partners, trying to do our best to provide access to the areas that, as I said, mostly affected. For instance, we are talking about IDPs representing around maybe 10% of the total population of Yemen. And now we are talking about more than 2.3 million IDPs all over the country, and they are in dire need for food, shelter, and of course medicines. And this is our role within the health cluster. We are leading the health cluster towards responding to their needs. So medicines and medical supplies we are trying to provide to those affected populations, where some of the health facilities, or many of the health facilities actually are not able to function. At least 70 damaged because of the war, and we know that not less than 30% of the total health facilities in the country are not functioning anymore, and partially functioning only maybe 50%. So we are talking about health system that is already collapsed, and we are trying to respond to that through mobile teams, through also managing to provide health teams or medical surgical teams to these areas, to provide the services through mobile clinics or through field hospitals. And during this ceasefire, for the humanitarian situation you mentioned, we are trying to reach the unreached population, because we are estimating that at least 15 million Yemenis are in need of medical help, and 21 million are in need for humanitarian assistance in general. So out of the 15 million that are in need for medical assistance, we were able during the past 9 months to reach only 50% of them. So during this ceasefire, our plan is to reach more and to try to provide the health care to those affected populations.
All right, Ali Mudhwahi from Yemen's Ministry of Public Health and Population, thank you for joining us.